The potential influence that ketamine has on depression may be contingent upon hope. The Stanford medicine team conducted an atypical experiment, discovering that the conviction of a patient that they had been administered ketamine, regardless of whether it was true or not, had the potential to alleviate their depression. Numerous studies have shown that ketamine, a psychoactive drug, can provide significant and rapid relief to individuals who suffer from severe depression. However, these studies have a crucial limitation. Participants are often able to differentiate between receiving ketamine or a placebo. Even in blinded trials where participants are unaware of which substance they have been given, the psychedelic effects of ketamine are usually a clear indication. Researchers at Stanford Medicine recently conducted a study where they implemented a clever strategy to obscure the psychedelic or dissociative traits of an anesthetic developed back in 1962. The study involved recruiting 40 individuals who suffered from moderate to severe depression and who were also scheduled for routine surgical procedures. During their surgeries while under general anesthesia, the researchers administered either a dose of ketamine or a placebo to each participant. During the trial, researchers and clinicians were unaware of which treatment the patients were receiving. The disclosure of the treatments occurred a fortnight after the completion of the trial. The scientific investigators were astonished to discover that both sets of participants underwent a significant improvement in their depressive symptoms, which is typically associated with the administration of ketamine. Dr. Boris Heifetz, an assistant professor of anesthesiology, perioperative and pain medicine, and the senior author of a study released on October 19th in Nature Mental Health, expressed his surprise at the outcome. It was quite unexpected to discover that some patients in the placebo group who claimed to have never felt better before and whose lives had been transformed were the cause of this result, he said. Within a day of receiving treatment, both the groups that were given the ketamine and the placebo had their scores on the Montgomery-Åsberg Depression Rating Scale, which is a conventional way to gauge the severity of depression, also known as the MADRS, reduced by an average of 50%. Their scores remained fairly stable during the 2-week monitoring period that followed. Dr. Teresa Lei, a postdoctoral scholar in the Heifetz lab and the lead author of the study, stated that the results of the study can be interpreted as a shift from severe depression to mild depression. This new finding raises further inquiries as it has taken an unexpected turn, according to the researchers involved in the study. According to Dr. Alan Schatzberg, the Kenneth T. Norris, junior professor in psychiatry and behavioral sciences and co-author of the study, all interpretations have now taken place. He compared this phenomenon to observing a painting by Picasso. After researching the matter, the conclusion was drawn that the observed improvements cannot be solely attributed to the surgeries and general anesthesia. This is due to previous studies indicating that depression remains relatively constant or may even exacerbate following surgery. According to the researchers, it is more probable that the positive expectations of participants are a crucial element in the effectiveness of ketamine rather than any other interpretation. During the final follow-up session, participants were prompted to speculate which intervention they had been given. Roughly a quarter of the participants claimed they were unsure. Among those who provided an answer, over 60% believed they had been administered ketamine. The participants' predictions did not align with the treatment they received, which confirms the effectiveness of the blinding process. Instead, their predictions were based on the extent to which they experienced improvement. Individuals who displayed more significant improvements in their depression scores were inclined to believe that they were given ketamine, regardless of whether they actually received it or not. This suggests that there may have been pre-existing positive expectations for ketamine. This phenomenon can be referred to as expectancy bias, the placebo effect, or just sheer hope. Regardless of the terminology used, the psychological components of treatment can wield considerable influence. According to Heifetz, some aspects of this are not novel. He states that placebo is perhaps the most potent and reliable treatment in the medical field, without exception. This is evident in every study conducted, and it is advisable to focus more on the factors that cause it. When considering the various factors that may influence the outcome of a study, certain elements must be taken into account. These elements may include the way in which the study is presented or communicated, any interactions that occur between the participants and healthcare providers, and in this particular instance, the inevitable media excitement surrounding the use of ketamine. According to Schatzberg, it will be necessary to construct experiments that are more astute in order to distinguish the direct impacts of pharmacology from the psychological influence of consuming psychedelics like ketamine. It is important to note, as Hefferts emphasized, that the key takeaway from these experiments is not that ketamine's effects are solely due to the placebo effect. It is important to recognize that referring to a placebo as just a placebo is misguided, he explained. The concept of a placebo is far from just a mere repetition of words until one feels better, nor does it suggest that the patient was not truly experiencing symptoms. There is a possibility of a physical connection between the placebo effect or hope and the mechanisms of ketamine. Research indicates that both may be partially controlled by the brain's M-opioid receptors, which are responsible for processing pain. Hefferts posits that there exists a definite physiological process that occurs within the brain when hope is instilled. The implications of the findings indicate that the therapeutic benefits of ketamine may not necessarily rely on inducing a psychedelic state, although this may contribute to the development of optimistic expectations in those undergoing treatment. According to Hefferts, it is possible to attain similar advantages without having to travel to space if a non-hallucinogenic psychedelic analog is used. The research conducted was made possible with the financial assistance of multiple organizations, including the Society for Neuroscience in Anesthesiology and Critical Care, the National Institutes of Health, Grants 3T32, DA0351650-2S1, UL1TR003142 and UL1TR001085, and the Stanford School of Medicine Research Office. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.